go ahead and get started because it's the end of the day and everybody wants to get wrapped up. My name is Deb Ramacher, and I am with Wisconsin Family Ties. First and foremost, I'm the parent of 3 children with special needs. They're not really children anymore. My oldest is 25, going to be 26 tomorrow, and is a mom, which was not in our plans, but turned out that it's been a really wonderful blessing. And then I have a 19-year-old daughter who will be 20 next month, and an 18-year-old son. 2 of the kids have had challenging emotional, social, behavioral challenges. My 2 younger kids have significant intellectual disabilities along with physical disabilities. Our oldest daughter has mild intellectual disabilities related primarily to epilepsy, and then also had some, and deals with some significant mental health issues, which is what got me into mental health world to begin with. I started out I was just talking to some of the other WISPE people. I started out with WISPE in 2000. So I was a parent liaison for the Wisconsin Statewide Parent Educator Initiative for a while. And then in 2008-ish, Chelsea started having some really, really significant mental health issues. We had suicidal stuff happening, we had self-harm, eating disordered things. She was in and out of multiple hospitalizations. In and out of multiple res centers. It was about 2.5 years of really, really awful, and then another few years of kind of bad. And during that time, even though I had been doing advocacy work for families and working with special ed and doing all that stuff, thought I knew how to navigate systems, when it came to having a child with behavioral and mental health issues, it was like a whole new world. So I got hooked up with Wisconsin Family Ties, who specializes in working with families that have social, emotional, behavioral, and mental health challenges, and that's how I got involved with them. I've been there since 2007. And then in the last several years, I went back to school and got a bachelor's degree and a master's degree for 2 reasons. One, because I wanted to. I wanted to finish my bachelor's degree that I started in lacrosse 35 years ago, and then decided to go on and get a master's in social work with an emphasis in therapy. And part of the reason I did that is because I always felt like there was something the professionals knew that I didn't know. And so I wanted to find out what that was. And I also wanted some credibility because I'm sure, as many of you, especially those of you who are parents, know, a lot of times you're just the mom. Even parents who are teachers or parents who have degrees, when you sit in an IEP meeting or you sit in one of those other meetings, you're just the mom. My just the mom stuff is probably, in terms of my work, some of the most important experience and the most important education that I've gotten. But I do very much value my education and my degrees. I did this presentation almost a year ago up north, and I had said something to the effect that what I really needed to learn, I learned as being a mom of children with disabilities, and got feedback on the evaluation form saying she acted like she didn't value education at all. And I started laughing. I thought, I've got $100,000 in student loans. I obviously value education, you know? So I don't want to give the impression that I don't think those are important. They are important. But when you're working with families of kids with challenges, there's something special and magical about connecting with somebody else that has those same things. With all of that being said, the other thing I want to say about this presentation is I think sometimes people come in, particularly educators and sometimes parents, hoping that I'm going to give them some special form or some magical structure that you're going to sit down together and create this behavior plan that's going to be fabulous and everybody can use it all the time and you never change anything. And that's not really what this is about. What this is going to be about is how do we become collaborative partners between school, between home, on both sides. You know, on the school side, what do I do from the school side to engage parents and help make the relationship successful? And what can I do as a parent to make sure that I am doing my part to try to make the relationship successful and be collaborative? I think a lot of times as parents, we forget that we have a part in how successful the relationship is with the school. That doesn't mean we have to take it all on, but we definitely have a part and we can make a huge difference in how those things work and how those things go. So I'll just kind of jump in from there. I like this. I'm sure many of you have seen it before, but I really like it because I've had to say it in IEP meetings a lot of the times. When you have kids that are qualified as EBD or with mental health issues, we so often go to punishment or we so often go to consequence. But when we look at all the other things that kids struggle with, if they don't know how to read, we teach them to read. If they don't know how to swim, we teach them to swim. If they don't know how to do math, we teach them. But if they don't know how to behave, if they don't know how to manage their emotions, we punish, we consequence, when in reality what we need to be doing is teaching. And challenging behavior is the main reason that kids are removed from the classroom, or suspended from school, or expelled. So as I'm sure you all know, there are lots of different beliefs and philosophies about how to manage behavior, how to parent, how to do classroom management, parenting with love and logic, 1, 2, 3 magic. I'm sure you've all heard of some of these. The one I'm going to focus on today is called Collaborative and Proactive Solutions. It's a model that was developed by Dr. Ross Greene. It used to be called Collaborative Problem Solving, but ironically, he and the person that he developed it with couldn't get along and, and went their separate ways. And the other person got the copyright to use the term collaborative problem solving. So now Dr. Greene calls it Collaborative and Proactive Solutions. With that being said, I still think a lot of what he talks about is very beneficial and valuable. So one thing you have to kind of go into dealing with behavior with the mindset that all behavior is communication. It's not about being naughty. It's not about trying to push your buttons. It's about trying to get a need met, trying to help you understand there's something I want that I'm not getting from you, or something I don't want that you're making me do. It's communication. It may be really ineffective communication. It may be really maladaptive communication, but it's a way of expressing something. And so the other thing I want to really hit on, and if I had one takeaway for today, it's thinking about how we look at kids. It's a little bit about what Kenesha was talking about too, our perspective. If you look at behavior and you look at challenging kids as they could do it if they wanted to. I've seen him do it. Last week he did it just fine, and now he can't do it today. They do well if they wanna. Versus, there must be something getting in the way. Kids want to do well. Kids want to be successful. Kids do well if they can. If they're not being successful, what's getting in their way? And I'm going to try to do this video. Dr. Ross Greene can explain it much better than I do, and if I can make this work.
I think if you're working with kids in general, but challenging kids in particular, you need a philosophy. Who is this kid? What's he about? What's he up to? If he's up to anything. Because you see, your philosophy is going to guide your actions, especially when the going gets tough. No philosophy, no guide. The most important theme of collaborative problem solving is this one. Kids do well if they can. Now, nobody ever falls off their chair at the sight of kids do well if they can. It's only an earth-shattering philosophy. If you consider a much more popular alternative philosophy that floats around out there called kids do well if they wanna. Now, kids do well if they can, and kids do well if they wanna are two completely different philosophies. And they have completely different ramifications for what you're going to do to or with this kid to make things better. Let's think about kids do well if they wanna for a second. If you've got a kids do well if they wanna mentality and you're working with a kid who's not doing well, then the reason you think he's not doing well by virtue of your philosophy is because he doesn't wanna. I've been thinking about kids do well if they wanna for a long time, and here's the conclusion I've come up with about kids do well if they wanna. It's wrong. Flat out, dead wrong. I ask myself, why would any kid not want to do well? Don't all of us do the best we can in the circumstances we find ourselves in? Well, the kids do well if they want a mentality has those questions covered with concepts like secondary gain, attention seeking, unmotivated, coercive, limit testing. We're going to have those babies put to bed by around 11 a.m. this morning. When you really think about them, they don't make much sense. When you really put them to the test, they don't make a great deal of sense. But let's say they do make sense. Even if kids do well if they wanna is right, and now you know I think it's wrong, it's narrow. Because you see, it greatly narrows the role that you can play in the life of a kid who's not doing well. Because if you think a kid isn't doing well because he doesn't wanna, I can only think of one thing for you to do, only one role for you to play in the life of this kid. Make him wanna. And we have the technology for making kids wanna. How do you make a kid wanna? You reward the behaviors you like and you punish the behaviors you don't. You give him the incentive to do well based on the belief that he didn't have the incentive to do well in the first place, and you are now in the business of making kids wanna. I sure do hope you're right about why he's not doing well, because if you're wrong and you're busy making a kid wanna, and he already does wanna, you run the risk of making things worse, or at the very least, not being as helpful as you might have wanted to be. I'm a kids do well if they can guy. I think if this kid could do well, he would do well. Something must be getting in his way. Your role just changed. Your role just changed. You've just flipped from thinking the kid isn't doing well because he doesn't wanna, and therefore thinking that your role in the life of this kid is to make him wanna, to something a lot harder, and in my experience, a lot more productive. You've just shifted to kids do well if they can, and what's your main role now? Figure out what's getting in his way. Then you can help him. You can't help him if you don't know what's getting in his way. Biggest favor you can do a challenging kid is to finally, at long last, be the person who figures out what's getting in his way.
So how do we do that? Ross Greene has several different tools that we can use. If you ever get a chance, read the book Lost at School. It's phenomenal. It really does a nice job for faculty and for parents. There's a new one out too that he just put out for parents, and I can't think of the name. It's Lost and Found or something. But Lost at School is beautiful in terms of how to help teams at school work together to help kids be successful and to manage the behaviors that are so challenging. One of the things he says that I thought was really interesting the first time I heard him say it was, the behavior doesn't really matter, whether it's kicking or spitting or refusing. The behavior is, some of them are bigger and smaller, and so we get more concerned about the big ones, but they're actually conveying the same stuff. A kid who's sitting and doing this might be doing the exact same thing as a kid who's throwing a tantrum and throwing things at you. You want to get at what's causing that to happen to begin with. So he has this nifty tool called the ALSUP, the Assessment of Lagging Skills and Unsolved Problems. And I won't go through all of it with you right now, but there's what you do as a team. There's a lot more to it than this, but what you do as a team is you sit down, you say, what's the behavior that's getting in this kid's way? Well, every time it's time for him to do his math, he crawls under his desk. What are we going to do about that? So you start as a team going through what are the lagging skills that might be contributing to that problem. And then you come up with ways to address the skills. There's things like difficulty handling transitions, difficulty in persisting, he gets like to small details on all these different things. Poor sense of time, difficulty maintaining focus, etc. I'm not going to make you go through all these right now. This also is a little bit longer than an hour presentation, so I'm going to go a little bit faster through it. A lot of times, too, we need to think about things that are going on the inside of the child, too. Difficulty handling stuff that might be going on inside and unable to convey those things. Difficulty empathizing, sensory motor difficulties. And then unsolved problems are kind of the things that we're looking at that we want to try to fix. Has a hard time getting out of bed to go to school in the morning. Has a hard time ending a favorite activity. We look at those things in relation to the lagging skills and problems and then do planning around that. We're all familiar with a variety of different behavior plans. Parents that have kids with challenging behaviors, I'm sure most of us at one point or another have had the functional behavioral assessment meeting with the behavior intervention plan meeting as part of the IEP. There are lots of different ways to set it up. Some really major things that you want to make sure you're doing is make sure that what you're planning is meeting what the needs are. Looking at what the needs are and putting a plan together that addresses those needs. Sometimes they don't coincide. And it should not, this is a biggie, it should not be a progressive list of reactive punishments. A lot of times we have crisis plans and behavior plans that start out with, if Jimmy starts to raise his voice, we do this. If that doesn't work and he escalates more, we do this. If that doesn't work and he escalates more until you get to call the police officer or restraint and seclusion or one of those things. So it's an escalation of punishments. That's not a very useful functional or behavioral plan or a crisis plan, because we're basically setting up crisis. How are we going to escalate this kid is almost how it is. Versus, how do we even get him to the point where his voice is starting to get louder? We got to go way before the voice is getting louder to look at how do we prevent that from happening to begin with. I'm going to talk a lot more about parent and family involvement, because that's the piece that is about bridging the plans between home and school. And there are lots of benefits. There's been lots and lots of research about it. And it's not just about families showing up and volunteering in the classroom for a birthday party. It's about active communication, active involvement. And these all make a lot of sense. Students whose families are involved have higher graduation rates, are more likely to go to college, do much better. When parents take on various roles, not just volunteering for the birthday party, but being an active participant, again, kids do better, they're more successful, kids have better attitudes towards school, and that just obviously makes sense. If the parents are involved and working with the teachers, the parents have a good attitude towards school. Our attitudes make a huge difference in how our children see school. And just kind of as an aside, one of the things I've noticed when I work with families, sometimes I'll be talking to a mom on the phone and she'll be saying something really pretty negative about the school, and I'll hear Jimmy in the background pipe up. And I think, oh my gosh, you're setting it up for failure when you do that. Not that you don't have every right to be venting to me about what's going on with Jimmy at school, but make sure Jimmy doesn't hear you, because Jimmy is a kid and doesn't have the context and doesn't have the understanding, and you're coloring the way that that kid looks at that teacher and at that school. When you can be, at least if you're neutral, you don't have to be pretending things are great if they're not, but at least be neutral and don't drag them into your discomfort or unhappiness with the school. Children from diverse backgrounds do better when family and school staff collaborate. It just makes sense. If families and schools are working together, everybody benefits from that. So family engagement is a big, big phrase right now. In fact, Wisconsin's statewide parent educator initiative calls when I was there, it was parent liaisons, now it's family engagement coordinators. Family engagement is a really big piece on the federal level of education. And one of the things I talked about at the beginning is who's responsible for that? Who's responsible for engaging families, and who's responsible for the relationship? Engagement is on the part of the school, but the relationship, I think, is on both sides. So Wisconsin Family Ties, several years ago, worked on developing a plan for family engagement. And it's called the Wisconsin Plan, because that's my executive director, his clever acronym. It helped him come up with a way to frame it, and it's actually very, very good, and it jumps to your brain right away. So what it is it's welcoming, inviting, perspective shift, just like Kanisha was talking about, perspective is huge, listening, accepting, and never giving up. And I'll cover those a little bit more. Welcoming and inviting is not just when you walk into a school, there's a banner that says welcome parents. It's a real attitude. It's when you walk into the office and the school secretary doesn't look like, oh God, here she is again. But hi, glad to see you. It's an attitude of we really want you to be here, not just we have to have you here, so come on in. And we see that, as parents, most of us are pretty good at reading body language and reading tone of voice and stuff. We know when we walk into a meeting and people are like, oh God, I have to do this IEP again. Or, oh my gosh, this is the fourth time I've had to talk to this parent. On the flip side, teachers also see when we're like, I know she doesn't give a about my kid. I know she doesn't really care. She just wants to get done with the day and get out of here. We read that stuff, so we need to be careful about how we talk to each other. But the welcoming and inviting piece is on the school. You need to portray that you really do want families to be involved. If you don't, you can't fake it. It's something you have to really genuinely feel. If you don't and you can't fake it, you probably shouldn't be trying to welcome people. And as far as perspective shift, that's a huge part of what we do actually at Wisconsin Family Ties, is just helping reframe things sometimes. It's really easy to go, for example, Mom is way too tied up with Jimmy's issues. They're like so enmeshed, it's unbelievable, it's ridiculous. We might go, it could be that, or maybe it could be that Mom really knows Jimmy really well and is really able to anticipate his wants and needs. It seems like we're all pretty drawn to looking at the negative, and that's what was being talked about earlier today too. In one of the sessions I was in, is humans are wired to look at the negative because of danger. So it's easier to say, oh, Jimmy and Mom are really enmeshed, versus maybe it's Jimmy and Mom are really well connected and Mom knows Jimmy really well. Another example, and this used to happen when Chelsea my oldest, was in treatment places and hospitals, was she would get really upset after we'd have a phone call. And I've seen this happen even more with families that I'm working with. They get off the phone and they're like, she can't have a phone call with her mom anymore. She just obviously gets her really, really upset. There's something going on with that mom. That mom's doing something that's getting the child upset. And our alternative narrative would be, maybe she's just really sad that she can't be at home, and she's really sad that she only has 10 minutes to talk to Mom today, and so that's really upsetting to her. So just looking at things in a different lens, instead of always going to the blaming lens or the negative lens, thinking about why. I wonder why that's happening. And then we need to have some working assumptions. And this is really important and it takes conscious effort. It's kind of like what Kanisha was talking about too, where you have to consciously think about how you are looking at the person that you're sitting across from and how you're talking with that person. We need to believe that all parents want to be proud of their child, that they want to have a positive influence, that they want to hear good news about their child and about what their child does well, that they want to provide their child a good chance to succeed and see their child's future as better than their own, and have a good relationship with their child, and feel hopeful about their child, and believe that they're good parents. And I know for some people, when you're working with kids that are clearly having trauma at home, that things are going badly at home, that there's something not going well at home, whether it's alcohol and drug abuse, or you still have to try to at least start with the assumption that this parent has some barriers that are making it difficult for them to be a good parent right now, to be the parent they want to be, but they want to be that good parent. Because it changes how you work with that parent. It doesn't really benefit the child for us to be really judgmental and blaming on a parent. It's not going to help anybody make any progress. It's not going to help the child do better. And we need to work with the parent to be successfully working with the child, because children live in homes with families. So how we look at families and how we act with families is really, really important. Listening, I thought this was really ironic that Larry King is the one that this quote is from, because in my experience when I've seen him, he never lets a person he's talking to finish a sentence. But he says, I never learn a thing while I'm talking. I realize every morning that nothing I say will teach me anything, so if I'm going to learn a lot today, I'll have to do it by listening. Like I said, it's ironic that was Larry, but it is a good thing to keep in mind when we're trying to learn and listen. And this is just a reminder that we listen with everything. We listen with our ears, our heart, our mind. And then, I'm sure many of you have had listening courses before, but we need to seek to understand before we seek to be understood. And I know I'm really guilty of sitting here and thinking about what's the next thing I'm going to say, especially when I'm in a meeting and we're doing like an IEP meeting and we have these different things we want to get through for my child and the plan we want to make. I start thinking about what I'm going to ask for next, or how am I going to reframe what they're saying to me, instead of just sitting back and thinking, I wonder what they mean about that. I wonder why they think that. Just really, really listening and paying attention and trying not to be judgmental, trying to have an open mind, trying to be across the table from somebody and remember that everybody at that table genuinely has the child's best interest at heart. I think as parents we can lose sight of that pretty quickly, and a lot of times with the parents I work with, one of the things I will say is most people do not get into education because they hate kids. And most people do not get into education because it's a glamorous, fabulous job where you make all kinds of money and you don't need to care about kids. Most people that get into education, especially special education, really care about kids, really want kids to do well, and really want them to be successful, just like most parents really want their kids to do well and be successful. It's so important for us to sit across from each other and remember that there's a person across the table who cares as well. Accepting. And now again, this is on the part of the school or the agency that's trying to engage the family. Looking at them with accepting open arms, basically. Accepting that their feelings and behavior is completely understandable given what's going on. If you're going through, for example, if your child has been hospitalized for the last 2 weeks and you've got 2 other kids at home and you're trying to go to work and get your work done every day, and somebody tells you you need to go and get signed up for this program, and you're like, I can't, I don't have the time. Accept that given that person probably is really stressed out and probably doesn't have the time to do everything that we think they should be doing. Just be really accepting about what's going on and conveying that to the other person. It's no wonder you're feeling that way. Of course you feel that way based on what's going on. And avoiding messages that are contradictory or dismiss feelings, kind of the same thing. Oh, you shouldn't be so upset about that. Lots of people go through that. Validate what people are feeling. And then the killer D's, deficit, dysfunction, and disability. Let's not talk about families as being dysfunctional or having deficits. Again, not the deficit model. Let's not go from a deficit model, but from a can-do model, and what can they do. And disability. How to communicate accepting, I hear what you're feeling, I understand what you're saying. One thing I would not do is say, I know how you feel, or I know exactly what that feels like. Even those of us who our whole job is about having a similar experience to the people that we're working with, I can't say to another parent who has 3 kids with disabilities, one of whom has mental health issues and the other 2 who are in wheelchairs, I can't say, I know exactly how you feel. Because I don't. I know how I feel to have kids with those situations. I have a sense of how it feels to struggle with some of the systems that we work with. I have a sense of the stress that can be part of what parenting those kids is like, but I don't know exactly how you feel. It's much better, actually, I think, to just say, I have no idea how that would feel, but I really want to help you, or I can't imagine what that must be like. That's so much more affirming, I think, to people who are going through more difficult things than we can't imagine. And then unconditional care. This is huge, and this is really big in coordinated services teams and wraparound, but it really should be, and this is what Wisconsin Family Ties strongly does and believes in as well, is we never close a family out. We never quit. We never say, we've tried everything and we can't help you anymore. Our philosophy, and I think many of the really good teachers and educators that I've worked with too, is if we haven't figured it out yet, we just have to try something else. There's always a solution. There's always a way to do better, to find what we need, to help the child do better. If the child's not succeeding, the adults around them need to take a look again, because there's always a way to make things better. And not to say, if you do this, then we'll continue to work with you. Oh, you didn't follow up on the things that we asked you to do last week, so we're just going to have to shut your team down. That's not useful. Families have again, it's kind of going back to it's not, no wonder you're having those struggles with what you're going through. Instead of saying, why didn't you get that done? What got in your way? How can I help you next time? It's really about helping people navigate around the barriers. So on the parent side, when I was saying it's up to parents to also have a piece of how your relationships are with the teachers and with the educators your kids are with, these are some things that parents can keep in mind when they're trying to form a partnership with teachers. Am I able to see the teacher as a person who is working with me for the well-being of my child? Again, seeing the person across the table, not just the teacher, not just the position, but the actual person. Do I clearly express the strengths and needs of my child? I think it's really helpful, and I've used this tool for a long time with families that I've worked with. It's called the Positive Student Profile. You can usually find it online if you Google it. It's a really nice tool for the parent to be able to go in, to think ahead of time, and to go in with a meeting with the school saying, these are the things my child really does well, these are the things my child loves. It was a little bit like what Paula was talking about earlier with learning who the child is. So when you're writing the plan, the parent can read your plan and know that you know the child. We can come in and help with that. We can come in with either something we write up on our own or this positive student profile that talks about who the child really is. Because I think if somebody knows who my child is, they're going to like them more. They're going to be interested in them as a person. They're going to see them as more well-rounded. They're not just going to see the issues and the challenges that we have to work with. And they're not even just going to see the strengths, but they're going to see what do they love, what excites them, what makes them happy. So really being conscious of bringing your piece to the table with the school. Do I state my desire to be an active participant in the decision-making process? And that doesn't mean do I go in and demand that they listen to everything I want them to do. It doesn't mean that I go in saying, this is my child, you have to do it the way I told you to do it. Let me, I can be in here whenever I want, I can do whatever I want, this is my child. That's not partnership. And we really, really want to try to partner with each other. It's coming in and saying, I want to help you. I know that you have a hard job. I know that you have 20 kids in your class, if you're lucky 20. Let's say 30 kids in your class, 5 of whom have special needs and IEPs. How can I help you be successful with my child? What kind of stuff can I do to help you out? What can I do at home that's helpful? Which doesn't mean pile a whole bunch of stuff on me, but let's collaborate. Let's work together to see what can I do. Tell me things you need and I'll see if I can do it with you or not. Well, let's talk about it. Do I come to appointments prepared with information I want you to have and questions I want answered? I'm really good at helping families do that when it's another family. When I'm going to somebody else's IEP meeting, I'm really good at helping them organize their thoughts and think about what they want to ask for. When it's my own child, you'd think I'd never been to an IEP meeting in my entire life. I can even come with my list and it kind of just all goes out of my head. So even practicing ahead of time what you want to talk with the teacher about. And again, do I understand that the teacher has the responsibility for working with many children, including my own? I have been frustrated with that, as have the parents I've worked with when they say, I'm so tired of hearing her say, I've got 30 other kids in the classroom, I can't do everything just for your child. But the reality is she has 30 other kids in the classroom and she can't just do everything for your child. So how do we help her do what our child needs and meet the needs of the other kids? Instead of saying, I don't care if you have 30 other kids in the classroom, I'm talking about my child. What if we turned it around and said, I know you have 30 other kids in the classroom and that's really hard, and my child needs to have these things done. How can we work together to make that happen? Completely changing how you say the exact same thing, basically. You're almost saying the exact same thing, but you're partnering versus attacking. Do I avoid letting past negative experiences or attitudes get in the way of establishing a good working relationship? That can be really, really hard for everybody. But there are parents that have had really bad experiences in school themselves. And I live up in the northwestern side of the state, and so we have small towns, and people stay in the towns often generationally. And so I'll have families that I've worked with where the parents have been in special ed, and their parents before them have been in special ed, and they've gone through expulsion, and they've dropped out, and they've had all kinds of bad stuff happen at school, and then they need to come in and try to work with sometimes the same people that were their teachers when they were in high school. It's really hard. I guess what I'm saying is, as a teacher, be cognizant of that could be something that's going on. As the parent across from you might not even be mad at you or upset with you. It might be their own relationship previous in their own high school days or their own background. Or it could be something outside of the school completely. And on the parent side, recognize that just because that happened with you doesn't mean it's going to happen with your child. And how you approach the school and how you work with the school is going to impact how your child's experience will be. And I'm sorry, I'm not going to get this done in an hour. Do I communicate quickly with educators when there are significant changes or when notable situations occur? Don't spring stuff on school staff. I've had it happen. And sometimes I understand the reason for it. Sometimes parents will start a med and not tell the school, or stop a med and not tell the school, because they want to see if it's really the med or if it's because people are waiting for the med to make a difference. So I get why you do that sometimes, but if possible, avoid doing that. Or when somebody did that, I thought was a really good idea, was to say, I'm probably going to start my child on an ADHD med within the next couple of months, but I'm not going to tell you when. I'm just going to let you know that I am going to do that. So keep an eye. And if you suddenly notice some really different behavior with my child, let me know. That way, you're able to track the changes in the medication without just blowing up the teacher's world. So partnering, again, about partnering. And do I regard teachers with the same respect I expect them to give me? That's pretty simple. And do I follow through on my commitments? Give teachers the benefit of the doubt. Assume they have your child's best interest in mind. Teachers really want to see kids succeed. That's why they do the job. They really want to see kids learn. Ask the teacher about the routines, communication, expectations, etc. And if there's something that the teacher has that's an expectation or classroom rule or something that you don't think your child's going to be able to manage, bring it up, talk about it. It's really important to partner and share your concerns as they're happening and as you think of them before they become a concern in the classroom. Try to think ahead. And again, recognize your attitude impacts your child's attitude. Excuse me, I'm sorry, I didn't realize that would be so loud. Sorry about that. Checklist for forming partnerships with parents. What can teachers and educators do? Put themselves in the parent's shoes and consider how I would feel and react in their situation. It's been really beneficial for me to have tons of teachers in my family. Because partly because I've gotten to see them start as a teacher. I'm thinking of my sister in particular who teaches in Minneapolis. Who, when she was an earlier, younger teacher, before she had children of her own, or her children were still pretty little, would say, I'm so sick of having to do these stupid charts and these stars and stuff for these kids. I don't have time to stop every 10 minutes and go, hey, Jimmy, you did this, put a star on his chart. Well, a few years later, she has now 2 kids who have ADHD and dyslexia, and it changed her perspective completely. And it's not because she wasn't a caring teacher, and it wasn't because she didn't care about the students she had, but she didn't recognize what it felt like in the parents' shoes. And I've seen that happen over and over again with lots of people who started out as the professional first and then had the kids with special needs. So just remember, just try to, if you can. You can't until you live it, but try to, as much as you can, empathize and put yourself, think, how would I feel if that was my child? How would I feel if that teacher said that to me about my child? Do I see the child in multiple dimensions, looking beyond the diagnosis or problems? That was one of the things I loved about what Paula talked about this morning, is having the shepherds. When you have a child who's identified with a disability or special need, they are suddenly under a microscope. So every behavior they do is looked at through the lens of, what is that about? When it could be just a typical 7-year-old kid making a fart noise, and suddenly, because you're an EBD kid, it's this big giant deal that you have to write a report about and do a behavior intervention plan for, and the kid next to him who's not identified nobody would blink an eye. So try to also remember to look at the child as just a child first. Do I believe the parents are experts on their kids? And I strongly, strongly, strongly believe that. That being said, I just want to throw out there that sometimes it's really hard for me as a parent and other parents I've worked with when teachers will, and it's not that you shouldn't ask us, but sometimes I don't know what to do either. And it doesn't mean I expect you to know what to do, but understand that sometimes I don't know what to do. Sometimes I have no idea. I have my middle daughter who has significant intellectual disabilities, communication issues, really difficult behavior. She does a lot of hitting herself and screaming and really disruptive behavior when she's unhappy, but we don't know what it is that's making her unhappy. And I've been partnering with teachers for 15 years, trying to figure it out. I think it's good to keep the conversation going, and I appreciate that they look at me as the expert on my child, but on the other hand, I might not know either. So I guess just not expect me to have all the answers, just like I should not expect you to have all the answers. Just because you're the teacher doesn't mean you have all the solutions to my child's problem. Just because I'm the parent doesn't mean I know all the ways to make my child better. But ask. But recognize that I might not know either. Do I believe that we're equals? I think most teachers are really pretty good about this. That we are equals in terms of the team. My opinion matters just as much as your opinion. I think some of the issues come with administration more than teachers. I don't see that a lot with teachers about I'm the teacher and you're the parent. So that's good. Do I listen to parents communicating that I respect and value their insights? Do I speak in plain language, avoiding professional jargon? That is, as many of you know, really, really hard to do. And now that I've been working as an advocate for so many years, I speak in FAPE, LRE, IDEA. I do it all the time too. I'm sorry, I don't know what to do with that. Excuse me. So try to be mindful of that. We have this thing, and I don't think it came from us, but one of our people on our staff does the jargon knock, or the acronym knock, especially when we have new staff starting. Anytime somebody uses an acronym, you just knock on the table and people know, oh, I'm sorry, I need to, because you use it so commonly you don't even hear it anymore when you're saying it. Do I always answer parents' questions? I want to know the truth too. I don't want to have people sugarcoat stuff to me and say, well, she's struggling a little bit. If she was really being a jerk this morning, I want to know if she was really being a jerk this morning, and what did that mean? What did that look like? And again, that's me. And I know you also have parents that don't. So again, it's about talking to parents, having a conversation. I'm really about just asking the question. Do you want me to tell you what's really going on with my kid? Or, oh, thank you. Thanks, Tim. Do you want me to be pretty direct? Do you want me to be, talk about it. I prefer people are direct with me. Don't be mean, but be direct. Tell me what's going on. Do I make appointments and set meetings at times and places that are convenient for the family? This is a tricky one for school staff. And I don't know exactly why. It used to be a lot better. I do know part of why, because teachers aren't getting paid to be at school anymore and those sorts of things. But, and maybe this is more of an administrator thing than a teacher thing. But I have noticed, as I said, I've been doing this for 16 years. Schools used to be a lot more accommodating of parents' needs in terms of setting up meeting times and meeting places. I don't know if that's not even possible anymore, but I think it would go a long way toward helping parents feel like their part matters, that they're being a part of the team matters. If there's a way to make that work, consider it. And do you follow through on your commitments? Contact parents at the beginning of the year to establish the best way to communicate. I love that. I love when, even just get an email saying, how would you like to keep in touch about your child? What's the best way to do it? Communicating positive behaviors. That one's always funny, especially for those of us that have kids that have a lot of behavior stuff. You're used to getting calls all the time about, the phone rings and you see it's the school. It's like, oh my God, hello? You kind of tentatively answer, no. And my daughter's teacher would always go, no, it's good. I'm calling to let you know this really good thing happened. Try to remember to do that because it's huge. It makes such a huge difference. It also lets us know that you really like our kid. When when you have a child that you're dealing with, that's hard. Maya is hard. And anybody who works with her day after day, God bless them, including us. She's at home now full time. So I recognize that she's really hard, but when I see you call and make a special point to tell me, Maya did this really cool thing today, then it lets me know that even with all the hard that you're having to deal with every day, you're seeing the kid that's there. You're seeing the person inside of the hard stuff. Arrive to meetings on time, blah, blah, blah. Have progress monitoring data in easy to understand formats. One of my kids' teachers for her master's project developed this really cool charting thing where she was able to chart the behavior, the goals. She'd take the IEP goals and put them on this really neat charting system. If any of you are teachers and are interested, I can hook you up with her. It's a really cool program. And it made it really easy for me to look at a glance and go, oh, I get it. This is what he was doing, now this is what he is doing. Sometimes, even though it's necessary, sometimes the 4 out of 5 trials will blah, blah, blah. It's really hard to conceptualize that, but when I can see it on paper or offer it in several different formats for the parents to understand, that's really useful. Ask the parents about, this is a tricky one for teachers too. I'm not trying to pretend that it's really easy to work with parents sometimes. We can be tricky to work with. Asking the parents about home routines, expectations, behavior management techniques. Again, sometimes it feels intrusive because sometimes we're already feeling defensive about, especially with our kids that have behavior challenges and mental health challenges. Often we're already feeling defensive or guilty about how we're doing things or not doing things or don't know how to do things. So when you ask us about, well, what time does he go to bed at night? That can immediately make me go, oh, does she think I'm not putting him to bed early enough? Does she think I'm not taking care of his sleeping? So it's really good. And again, just preface it with, I'm trying to figure out some ways that we can do things similarly here at school that you do at home. Tell me about what his normal day looks like after he gets home from school. Tell me what a Saturday looks like. I'm just trying to get a sense of how we can do things in a similar way or do things together. What to do when you can't seem to agree. We have 1 minute left, so I'm going to just go right past that. I have all of this stuff on my handout, and it's really pretty easy to read.
You have till 3:15.
Oh my God, I was thinking I had till 3. Never mind, I forgot. So you got me for 15 more minutes, you lucky people. So what do you do when you can't seem to agree? Some of the barriers on the school side, barriers to working well with parents are lack of trust, previous experience with tough parents, or hearing from teachers further down that when you have a student coming up that has a parent with a reputation, hearing about that parent before they even get to you. Perspective through the years. I think it kind of goes both ways that way. Sometimes new teachers kind of come in with a really open mind and don't have preconceived notions. But I also think teachers that have been teaching a really long time often have a really good way and sense of how to work with parents. If you're still in it after quite a few years, you figured it out. You figured out how to, most of the time, how to collaborate and work well with parents. Demands of the position is huge. You know, when Kanisha was saying teachers are like, I have one more thing to do, I can't tell you how many times I hear that. And we do expect so much from teachers. Schools need to have, this is me getting up on my soapbox, but schools need to have more guidance counselors. Schools need to have more social workers. Schools need to have more support staff that are helping with some of that other stuff so that teachers can deal with teaching. Right now, teachers are doing social skills and academics and helping kids who are coming from really hurting situations and trying to deal with that, and making sure kids have enough food to eat, and oh my gosh, why does this child have the same clothes on for the 5th day in a row? And we need more people besides the teachers doing those jobs. And again, as parents, we can be supports for that. But just for us to recognize as parents that teachers have a lot of expectations placed on them. And now they have those expectations, and they have less bargaining power, and they have lower salaries, and they're paying more out of their checks. And there's been this whole narrative about educators over the past several years that has been really demoralizing to teachers. I think it's really important for us as parents to recognize that too, and to celebrate teachers when we can. And the number of initiatives that keep coming down from the state, they keep changing how they want teachers to do things, or all of the testing. I know that's been a huge thing for a lot of the teachers, teaching to the tests. My sister's been teaching for 18 years, I think it's 18. And in the last like 4 or 5 years, she is so frustrated with how teaching is going, because she said, you know, I've got these kids, and she teaches in inner city, and her kids, some of her kids are transient and come and go, and you know, are homeless, have parents who are incarcerated, really tough stuff. And she's like, she gets really frustrated that her job performance is based on the numbers these kids get on these tests, when she might be doing all these other really great things to help these kids, and she's sparking in them a love of learning, and she's doing all those really great things, but what her being judged on is the scores on the tests. That's a huge thing that teachers struggle with. Teachers don't get into teaching to do rote testing over and over again. They want to spark a love of learning. They want to teach kids about how to learn, all those kinds of things. And so that's a struggle that they're dealing with right now. I talked about the medication changes. Just try not to spring it on them if you can. Barriers from the parents' perspective, again, lack of trust. I think there's a lack of trust on both sides. Previous experiences with the school, like I said. I don't think I have this here, but part of the thing that we struggle with as parents of kids with special needs is we automatically assume that people feel like it's our fault that our kids are struggling. So you may not think that at all, but I'm already walking into the school thinking that you think that about me. So it makes me have a barrier up already. It makes me a little bit more defensive and a little less open, a little more guarded. So that's just kind of something to think about too. The grief cycle, and that can be really challenging and comes and goes. One of the other things I've learned doing this for a long, long time, when I was a newer parent of kids with special needs, and I see this with newer parents all the time, we want to fix our children when they're small, when they're in early childhood, and when they're in elementary school. We want to make them all better. So if we just get the right therapy, if we just find the right doctor, if we just do the right exercises, if we just find the right physical therapist, if I just read the right book, if I just find the right teacher, if I just get them in the right classroom, if I just don't miss this opportunity, I'm going to fix everything. And as you go through life, you find out you're not going to fix everything. You can help them be as successful as they possibly can, and you can bring them a lot farther than you might have ever thought you could bring them. But what I tell young parents now all the time is it's a marathon, it's not a sprint. Parents get panicky. We get really panicky because it's like, if I don't do this one thing right now at this one time in this kid's life, I'm going to miss it and he's never going to get it. And it's going to be all my fault that my child didn't get that, whatever skill it is. It doesn't work that way. There are windows of learning, but that doesn't mean the windows slam shut if you're not within a very certain time. And windows of learning are averages. They're not, every child will learn this skill between this age and this age, especially when our kids are wired differently neurologically, and their brains are working differently. A very concrete example for me was my youngest son, I was told would never speak. He won't talk. And then he started doing the stuff, like early speech stuff, when he was like 3 or 4, that kids do when they're like 6 months old. Brought him into a speech pathology clinic at the university nearby my house, and the person there said, oh my gosh, he's doing all the milestones exactly right. He's just doing them like this. So he may be years and years and years before he says anything that's an intelligible word, and then it may be years and years and years before he has sentences, but he's doing everything just like typical kids do in a much shorter period of time. I'm gonna cough again. So what has happened now is Michael is 18. He said his first word at 8, his first intelligible word at 8. He's still learning how to put words together into sentences. He talks all the time. It's that whole be careful what you wish for. Because he also likes to say the same things and practice the words over and over and over again. But, so he's 18. I was told he would never speak. He speaks, he communicates, he's understandable to people who know him. There's no special magic window. Each kid is going to learn things differently. You don't have to panic about if I don't do it right now, it's never going to happen. And you never know what the right thing is going to be either. The right therapy, the right book to read, kids are people are a lot more gray, shades of gray than that. There's no black and white. If I do A and B, my child will do C. So then the whole grief cycle when that stuff comes up again too, when you have kids with special needs, and all my kids have special needs, so I've never raised a typical child. So you get really used to this is how it is, and this is how your kids are, and it's really normal for your 19-year-old to be singing Barney at the top of her lungs, and no big deal. But then you go out in public, and you're like, she's really not like a typical 19-year-old. It kind of strikes you. So there's that kind of thing too for parents that have kids with special needs. It's like you get so used to it that you don't recognize it, and then you kind of get hit in the face when they're not going to prom, or they're not getting a driver's license, or they're not doing all those things that typical kids do, because you get used to what you're going through. And so it never goes away. You don't get to just like grieve it and be done with it. You grieve this part and then you move on and things. And it's not a giant life of grief either. That's the other piece of it, is it's not this terrible, tragic life. There's so many joys, and there's so much excitement, and there's so many rewards. So one of the things that a friend of mine and I have said many times is you kind of have this balance of, don't feel sorry for me, I don't want your pity, I love my kids, they're fantastic, and why don't you feel sorry for me? My life is so hard and things are so tough and I have to deal with all this stuff. And you kind of do walk that balance as a parent of kids with special needs. Life is great and things are fine and I don't want your pity, but damn, life's hard, and why don't you understand that I'm having a hard time with this? So just kind of recognizing that and thinking about that experience with parents. And that's the jargon we talked about already. Handling differences of opinion. You're going to have differences of opinion, obviously. Start with what you do agree on. Even if it's just simply, we both agree that we want Tommy to be successful. Even if that's where you just start. We don't agree how to get him there, but we both agree that we want him to be able to do this thing. So let's start there. And then just share the ideas. Keep an open mind and try to take the other person's perspective. We did an exercise one time with our special ed staff and some parents that had gotten together, and we had to role play the other person's role. That was really eye-opening to me. It was when my kids were younger, but I had to be the special ed teacher. And it was really eye-opening to me. It really made me go, they really do. I don't mean to sound offensive when you're gonna be like, well, yeah, we do care. But I was like, they really do care. They really are fighting for this particular thing. They might be not looking at it the same way I am, but they really are. Again, just perspective, thinking the other person's viewpoint and thinking about, we have so much division. I'm not gonna get into a big political thing here, but we have a lot of division in this country, and we're very my way or the highway. It seems like there's a whole lot of that. And I think the less we do of that and the more we talk about what we can do together, what we agree on together, where our common ground is, you can build from there. Even if it's just the one small thing that you have common ground on, start there. Acknowledge each other's viewpoints. And don't try to, I have a really hard time with this. I'm terrible with this, but I always worry about trying to talk somebody into my perspective. How can I logically explain to them how they should think the way I do? When what I really need to do is hear what their perspective is and make sure I understand it. Doesn't mean I agree with it, and I think we struggle with that too. Just because I understand how you feel about something, or I get where you're coming from, and that doesn't mean I agree with it, but if I understand it and I get it, it helps me work with you better. It helps me get where I can come to agreement with you on whatever piece it is. So really just being very open and never giving up. Don't feel like throw our hands up, we can't work together. We always can work together. We can always find common ground. If we take ourselves out of our needing to be right and get to needing to do something good. Be a team player. I know some of this stuff sounds really corny, but it really does matter. If you look at it as we're a team for this child, then we work together as a team. Work with each other instead of in spite of each other. I think it's really important to just put it out there that there are differences. It's okay. I like having things out on the table where instead of a subterfuge where you're seeing that people are looking at each other with these looks on their face and I'm really angry, and you see all that stuff but nobody acknowledges it. I'd much rather have on the table, I know you guys are really frustrated with how this has been going. I know that you feel like I'm not doing enough at home, that I haven't been doing enough homework. I get that, I understand that. And I'm feeling like you guys aren't understanding my perspective. Let's try to figure out a way that we can get past that. Because if you just put it out there and say, we have this thing that we're having a problem with, then you can work on the thing that you're having a problem with. If you don't talk about it, it eats away at the relationship between the school and the parents, I think. And remember, we're all there for the same reason. We just might disagree on how to get there. We all want to be successful with the child. We just might not agree on how to get there. These are some resources. Of course, I put Wisconsin Family Ties first because I'm there. But WISPE, the Wisconsin Statewide Parent Educator Initiative, and we all have a little bit different focus too. Family Ties is parents of kids with social, emotional, behavioral, and mental health challenges. We don't need to look at any specific diagnosis. If they have one of those challenges, we work with them. WISPE is a lot involved with special education in particular, and getting parents and schools to work together, family engagement. That's WISPE's really wheelhouse. Facets is special ed oriented. They do a lot of training, a lot of education, a lot of webinars. And all of these organizations do some of that stuff. We all kind of overlap in some ways, but those are kind of the main areas. And DPI's website is phenomenal. If you're trying to find out something, and Google too. I am like the Google, I love Google. You can find anything you need with Google if you just know how to ask the right questions. So a lot of the times when you're looking for resource information, ask the questions and ask them over and over again, and it'll take you to the different places, and then go to the websites and read them. But DPI's website can really give you a lot of what you need to know. When I have somebody call me up and say something like, does my school have to do a manifestation determination before they expel my child? You can find all that stuff on DPI and explain exactly how it's supposed to happen and why it's supposed to happen in very understandable language, so I'm a huge fan of using their website. People that can help you out in your own area, special services directors. I think sometimes we think when we're having problems with the school, they're not our helpers, but they really do, again, really want to help make things work for the student and the teachers. They kind of have everybody's best interests in mind. They can be really helpful. School psychologists, guidance counselors, teachers. If you have a school social worker, absolutely, they can be really helpful. I think in our CISA, which has 39 schools, has one school that has a social worker. So there's not a lot of them around, but if you do have them. And then these are just a few websites, and again, they're on the handouts that are on the website. Some resources, a bunch of books that you can read that are helpful. And I have 1 minute left. So if anybody has any questions, let me know. I'm sorry this was really fast and kind of... Well, thank you all very much. I appreciate your time. I'm available after if you have any questions.